Good morning, everyone. Happy Friday, and welcome to another episode of Sit Call. I'm Staff Sergeant Scott McMenemy with the Valencia Army Medical Recruiting Station. Also with me from the station is Sergeant First Class Michelle Phillips.
Hi, good morning.
And Sergeant First Class Michael Cube.
Morning, everyone.
Today we're talking with Major Stacey Bateman, who is an active duty Army microbiologist. Thank you for being with us today.
Good morning. Hi, Valencia Recruiting Station and audience. I'm happy to be here.
So, ma'am, can you start off by telling us a little bit about yourself?
Sure. As you already mentioned, I am an active duty Army microbiologist. I'm currently stationed at Joint Base Lewis McChord in Tacoma, Washington, where I am the Deputy Chief of Microbiology.
So, ma'am, when did you make your decision to join the Army?
So I thought about joining the Army actually when I was in college, in Swarthmore College, and didn't have an ROTC program. So at the time I was looking at pre-med and science career paths. So I actually considered joining at that point in time without much of an avenue. I fell in love with science and medical research, and so continued on the academic path and went to grad school at Duke. And while I was completing my graduate studies in microbiology and molecular genetics, started looking at kind of career fields and knew that the Army and the military in general needed physicians and nurses, but didn't understand how much of a footprint they had on the research community and biomedical research specifically. And so started looking at those opportunities and fellowships and ended up finishing up my graduate degree and then commissioning as a direct commission about a year after that as an Army microbiologist.
Can you tell us a little bit about your current assignment?
Sure. So as I mentioned, I am the Deputy Chief for Microbiology at Madigan Army Medical Center. So we are located in Tacoma, Washington at Joint Base Lewis McChord. And in general, my day-to-day looks a lot like a civilian counterpart would for clinical microbiology. So I work in a lab and I oversee the testing and bringing on new technologies to identify the infectious causes of patient symptoms. So the patients, the active duty patients and DoD beneficiaries we see here at the hospital, all of their laboratory or the majority of it gets done in the laboratory at Madigan. So anything related to infectious diseases, identifying the cause of the illness and the symptoms, investigating the organism to advise on treatment plans, that looks very, very similar to what we do on the civilian side. If you were to go to, your local community hospital or academic medical center, if you had an illness of some variety, we do have a different patient population. So always on our minds too is supporting our active duty population and their operational requirements. We can deploy as part of those units as essentially their medical expertise if there's a field hospital that is deploying. But predominant day-to-day at the hospital looks very similar to the clinical environment.
So, ma'am, where have you been stationed?
So I've had a bit of a diversity of assignments. So initially, my first duty station was at the U.S. Army Medical Research Institute for Infectious Disease. So this was particularly on the research and development side for finding solutions to infectious disease issues. So diagnostic systems development, therapeutics, and preclinical work. That was located in Fort Detrick, Maryland. That's actually where I met Sergeant McMenemy way back a few years ago. And since then, I've been at the Pentagon briefly. After that, I went overseas in support of the Ebola response in 2014 and 2015. came back. Actually, that's when I had my Pentagon assignment, and then was overseas again as part of a research effort on infectious diseases in Kenya. And then from there, I PCS'd here to Joint Base Lewis McChord at Madigan.
So, ma'am, we get oftentimes asked by folks what it's like to do research in the Army. And we know, because we were talking offline, that the Army is pretty much a leader in this area. Can you talk a little bit more about the research capabilities that you have?
Absolutely. This was actually a question or an unknown for me when I was looking at the military and the Army specifically after grad school, is not really understanding the scope and contribution of military medicine to the research community. And because we deploy soldiers globally, we face infectious disease issues across the globe. So we have a lot of overlap with our civilian and NGO and public health sectors of research in identifying solutions to infectious disease issues that we may not see here stateside. And so there's a very large community that falls predominantly under the Medical Research Development Command. And that's essentially where most of the research labs focus their efforts. Now, as a microbiologist, I'm particularly interested in the field in general on solutions to infectious diseases. Is how do you detect, diagnose, treat, and prevent infectious diseases? So the research really runs the spectrum of things that are used to diagnose an infectious disease, to treat either a drug or a therapeutic option, or prevent. So either a vaccine or preventative measure in that respect. But the community at large focuses on all sorts of medically related research on, combat casualty care and wounds, everything from designing new combat action tourniquets and, litter carries for combat patients, as well as the infectious disease solutions that I spoke about earlier.
So you mentioned earlier that you've been to Kenya before. Can you kind of tell our viewers a little bit like what that experience was like for you?
Absolutely. So we have the U.S. Army Medical Research Institute, or U.S. Army Medical Research Directorate in Kenya, has been there since about 1969 in partnership with the Kenya Medical Research Institute. And it's focused predominantly on infectious disease research and surveillance activities, things that we necessarily wouldn't see here, but are strategically important kind of in that geographical area. So while I was there, I was the chief of their microbiology lab that focused on enteric diseases. So your pathogenic E. coli, salmonella, cholera, in that nature. We worked very closely with some of the labs back in the United States on developing tests and treatments for those illnesses, for those diseases. Being in Kenya itself, though, was, I would say I was hesitant initially just because I didn't know what to expect, but exceptionally glad that I took the opportunity to go. I was scheduled there for a 1-year assignment and actually extended for a second year. And that is one thing that you will see in the military, is having the opportunity to travel and take on maybe challenges or opportunities that you didn't think you might otherwise have. So I loved my time there. I would consider going back, and actually got some personal travel opportunity as well to tour the area that I probably never would have otherwise gotten.
So there's some other aspects of being an Army microbiologist that the civilian folks don't have the opportunity to do. Things like Captain's Career Course you were speaking about. I also know that you have a couple other badges. Can you tell our folks a little bit about the EFMB?
I can. So you bring up a good point, Sarah Phillips, is I am a microbiologist and I'm a scientist on a day-to-day basis, but I'm still an Army soldier first. And so there are a lot of things that the Army requires of you that you may not, you would not have on the civilian side. So you are in uniform and you are a soldier first. So the EFMB, as you mentioned, it's Expert Field Medical Badge. So that's open to anybody in a medical field. So I generally do not treat patients in any form or fashion. I'm not a combat medic or a physician. But you can sign up for the course. It's about 3 weeks in length. You go through all the standardizations on how to assess, evac a casualty or a patient. So you go through medevac, you go through soldier warrior tasks and drills. You go through some chem bio training, and essentially your practicum, so to speak, is the combat trauma lanes. So each of them has a different focus, and you essentially, under a simulated environment, run through all of the things that you need to learn on treating and assessing combat casualty and medevacing. I recommend that anybody go ahead and do it. It's not something that I generally use at all on a day-to-day basis, but the training was exceptional. You're focused on your Army warrior tasks and drills. And if you were to find yourself in that environment, the skill sets you kind of trained and needed to evaluate and medevac a patient. So I advise anybody, even if it's not your particular specialty, to go ahead and go for that challenge.
I know I had fun going to it. So man, what does your career progression look like?
So I'm going to use an analogy here because this is something that's a little bit different than the civilian side. So as a microbiologist on the civilian side, often you will specialize in a specific area or subspecialize. I'll say you're a single sport athlete. In the military and in the Army, you're really expected to be a pentathlete. You are going to take positions that are all related to infectious disease, and you will be a subject matter expert in infectious disease. But those positions are going to diversify your background in different areas related to that. So my current position, I'm a clinical microbiologist. I'm focusing on clinically diagnosing and treating patients with laboratory medicine. There are research positions where, again, the outcome is ultimately focused on a patient, but you're actually doing the research and development on finding those solutions. And that's much more in the science realm. And then there are other opportunities within the acquisitions community, or program management is a little bit more. Acquisitions is the DoD kind of business management of technological advancement of those solutions to something that is an end product that is usable. And then you also have essentially broadening and leadership opportunities. So while I am a microbiologist, I've spent time as an acting company commander, which is generally something that my AOC or my area of concentration doesn't often get the opportunity to do for several months at a time. And that's very much an Army leadership position and development. You will have those opportunities from the tactical to the operational and strategic level. So you may be a staff officer at times, advising battalion or brigade staff. You may be an executive officer for instance, an area medical lab, which is a deployable medical laboratory asset. You may be a chief of staff at some point in time, unrelated, or an aide that's drawing on your military development and leadership development, not necessarily your medical professional development. So it's really a balance between your medical profession and your Army profession, as you advance throughout your career.
So, ma'am, we're getting towards the end of our segment this morning, and I guess a question that we like to ask everyone that we have, because at the end of the day, we are healthcare recruiters, and we are trying to find folks to come work alongside you in your field. So, if you could offer one piece of advice to any microbiologist that is out there that may be considering a move into Army medicine, what advice would you offer to them?
All right. So advice I would have given myself at the time when I was considering this would be to be adaptable. Adaptable in the positions that you're going to take and some of the challenges you will face. There's a balance between the needs of the Army, as we say, and our professional, personal goals. And for me, that's really aligned beautifully. I like part of what drew me to science is new challenges and learning new things. And the Army career progression for me, I get those opportunities, and I view that absolutely as an opportunity and a positive. But just be aware that you will be asked to do things that are maybe outside of your comfort zone, to be adaptable and to be open to taking on those challenges, be it professional or personal. And I definitely have grown the most, and I think have had some of the most rewarding experiences from some of the positions or projects that I necessarily didn't think I wanted. They were opportunities to excel, so to speak, but they probably have enriched my professional development the most.
That's awesome.
So, ma'am, I'd like to thank you again for taking time out of your schedule to visit with us today. And it was also nice seeing you again.
You too, Sergeant McManamy. I'm happy to be here, and I appreciate all of your time.
So with that, this will wrap up another episode of Sick Call. Thank you to all of our viewers for tuning in with us live. And as always, we welcome your questions. You can comment below or on any of our other social media platforms. We hope everyone has a happy, healthy, and safe weekend. And we look forward to seeing you again next week here on Sick Call.
Bye.
Bye, everyone.
Bye.